Good evening, everyone, and welcome to Happy Feet. Tonight we have a fantastic speaker, and the topic is coping with body image concerns, a normal part of the cancer experience. And we have Dr. Michelle Fingeret with us from Fingeret Psychology Services. And just to share a little bit about Dr. Fingeret, she's a licensed psychologist with 20 years of experience specializing in body image and cancer. She obtained her PhD in clinical psychology at Texas A&M University in 2004 and completed her postdoctorate training at MD Anderson Center, MD Anderson Cancer Center. Dr. Fingeret was a faculty member at MD Anderson for 10 years where she, hold on, where she developed the only program of its kind focused on addressing body image issues for cancer survivors through a combination of can, uh, research, patient care services, and educational activities. She has published over 50 peer-review research articles and has been awarded numerous grants from the National Cancer Institute and the American Cancer Society. She created the first and only academic textbook on body image care for cancer patients. She is a fellow and former president of the American Psychosocial Oncology Society. Dr. Fingeret and Fingeret's founded Fingeret's Psychology Services in 2017 to further her work in body image education and support for oncology healthcare professionals and cancer survivors. So she is coming in from Houston, Texas. So I will unpin myself and you can take it away, Dr. Fingeret.
Okay. Can you see my screen now?
Yes,
And let me actually make it presentation style. Okay, we're ready. I'm ready.
we're ready.
Let's go. So, what I want to say is how much I am grateful to be here with you today. And this is a topic that I talk about a lot. My goal is to actually give you all some very practical pieces of information, tips, and strategies to help cope with body image changes. And I want you to know that this is a talk that I not only give to survivors and patients, but I also give a version of this talk to healthcare professionals. A really big part of my work is actually teaching healthcare professionals how to better care for cancer survivors as they're going through treatment and to focus on body image issues because I don't think that there is enough focus of that in the clinical encounters. And I'm trying to help educate professionals how to be more sensitive to these issues. But today I want to talk with you about kind of your own body image journey. What does body image mean to you? There's going to be times during the talk today that I'm just going to pose a question, and I want you to obviously just think to yourself, reflect upon it. If you maybe want to take it down and even think about it after our session this evening. But really, the reason I start here is because body image is such a personal and private thing. It means different things to different people. If I asked you all to define body image, I know there'd be a lot of things coming back around attractiveness and appearance and things like that. But it really has a lot of different meanings. And I want to help you think about this in a very broad way to understand because cancer and its treatment can affect body image in so many different ways. That's why this topic is so important to address. So I do work in an academic setting. I have done a lot of research in this area, and it is always important at the very beginning to define the concept and the construct of what we're talking about. So I offer a definition of body image. This is how I define it. That doesn't mean this is how you have to define it, but at its very core, body image is the personal relationship that you have with your body. And I do believe that it refers to more than just physical appearance, though appearance is a big part of body image, what you see when you look in the mirror. It also, however, involves other ways that you might perceive and think about all aspects of your body and its functioning. And it's important for us to talk about that because the way that cancer and its treatment can affect you is more than just things that are visible to other people or things that affect your appearance. It's the way body sensations, body functions, there's lots of different aspects of that. And so when we think about it in a much broader context, we can understand why this is such a core issue for cancer survivorship. Um, what I want to say is that the biggest and most important concept of body image is that it's completely subjective. And what that means is it's only about how you experience your own body. And that's an important thing to say because many of you probably have experienced that Maybe your loved ones, friends, family members, even your healthcare team don't perceive your bodies the same way that you do. There can be a disconnect sometimes between how you experience your own body changes and what somebody else sees or how they comment upon that. And I kind of want to bring this back to the idea that what really matters and what only matters to me as a body image specialist is how you perceive your own body and your body experiences. So, at a very basic level, we want to kind of understand the influences, what influences body image. We know that, age and gender, your cultural beliefs, certain physical characteristics, messages that you were given about your body and about appearance from your family and from your culture are all things that set the stage for how you experience your own body image. Of course, society can influence that very significantly. We know there's a lot of ideals for appearance, different ideals for women and men, for example. The mass media, social media, all of those things impact how we feel about our bodies. But the reason why we're all gathered together tonight is to really focus on this external event that even further impacts body image, which is cancer and its treatment. And so it's important to just put that context together. So here's a reflection point, something that I would like for you to think about tonight and maybe after this talk as well, is when looking back on your life, can you think about any significant memories or traditions or values that have had the greatest impact on your body image? Um, Sometimes I do workshops with people and we'll sit with this for a minute and I'll get them to write things down. But it really starts to help you understand more if there are struggles that you're having around body image changes, to know that there are reasons why that is. And it's because of how your body image developed over time and what is impactful and meaningful and what memories and experiences you've had that have shaped how you experience your body. Um, I want to talk a little bit about what I'm going to refer to as my kind of body image 101 for cancer survivors. The very first part of that is understanding that you're not alone in this. All cancer survivors have to go through some sort of process of body image adaptation. Something in your body has changed, and it could be something big, something small, something gradual, something acute. If you had surgery and you woke up and you had a big change, it could be something temporary, more long lasting. There's all kinds of things that happen to your body, and understanding that like everybody goes through that helps you understand why body image is such a universal issue. And what I would say is, unfortunately, the majority of people who go through cancer treatment will have concerns about changes to their physical appearance and body functioning at some point during treatment. I often like to tell people it's actually not normal or more abnormal for you to not have any of those issues at all. That would place you in a category of people, very few. The majority of people are going to have some sort of concerns or challenges in that area. And that doesn't mean those challenges are insurmountable. We can, address those. I want you to have hope that all of that can be dealt with and coped with. But the reality is, you're not suffering alone. There is a whole body. I mean, that's the whole reason why I think you have this group together, is to be together and talk about various issues, or you have commonalities. But really, one thing that I work really hard to help people understand is that body image is important and meaningful. I hear way too often from people that they feel guilty or ashamed about having concerns about body changes. They don't feel like they should bring this up to their healthcare team. They don't feel like they should be bringing this up to their family or friends, or people get tired of hearing, or they don't want to hear you um, complain, if you will. They feel vain for having body image concerns. And I really would love for you to be able to try to set that aside and set that judgment aside, because body image is important and it's meaningful. I ask you to reflect upon what aspects of your body are the most meaningful to you. And if that is an aspect of your body that is being impacted by your illness and its treatment, it would only make sense that you would struggle with that to some degree. And that other kind of question is, how has illness affected these aspects of your body image, the parts that are important to you, right? People losing hair, or people having, losing a breast, or other parts of the body, or having compromised issues in certain areas. There can be a lot of reasons why that particular issue is challenging for you. And the other thing I want to point out is that body image issues can arise at any time. Some people are walk into the treatment experience being having a lot of anticipatory anxiety around body image changes. Other people aren't focused on that at all and say, you know what, I'm not concerned about that. Let me get through my treatment. I'm just feeling, grateful to be alive and, have the um, be able to move forward with things. And it's not until later that those body image issues come about. And for some of the people I work with, if the body image issues aren't there when they first start treatment, but they come about later, that sometimes can actually be a source of confusion or a source of guilt or a source of shame of why is this coming up for me now? I just finished my treatment. I should be able to move on and be happy, but I feel stuck in a little bit about why things maybe didn't go the way I expected, or some of these body image changes were unexpected. And all of that, I just want to tell you, is very normal. There is no one time that you have to have these body image concerns or issues. They can happen at any time. So, in case you were wondering, I put up here this slide just to really give you the broad range of the types of body image concerns that can be very common for cancer survivors, not just focused on physical appearance, though you'll see scarring and disfigurement, hair loss, weight changes, but things that maybe you haven't really thought about as a body image change, sensory changes, numbness, tingling, or pain, changes to speech or swallowing, changes to physical strength or stamina. Sorry, I have to do this here. These are all things that can impact the way you experience your body. So it just sets the stage. And then I'm going to focus for just a minute right now on body image and grief. This is an important area to talk about because processing the loss of a body part or processing the change in a body functioning can be one of the most challenging aspects of cancer treatment. And, we want to think about not only what you might go through if you have anticipatory anxiety around changes, so you're anticipating the loss of a body part or the change in a body part, but also maybe grieving that you go through over recent losses to your body or changes to your body. And I think it's part of this is just understanding that grief process, that grief unfolds in a lot of different ways. There's not one way that that process happens. I think part of it is knowing that when you're experiencing some intense emotions around body image changes, you can associate that somewhat with the grieving process. Um, that can help provide a framework for you. But I want to talk a bit more about what we can do about this. Okay, I'm having issues advancing my slides here. Hmm, Sorry, y'all. Okay. Oh, okay. So this is where I get into one other piece is to just kind of think of this. I do ask people to think about where you might fall on this body image continuum. Okay. So what I want to tell you is that most people are going to be right there in the middle. They're going to have what I call average or normal amount of body image concerns as they go through cancer treatment. These are mild to moderate difficulties adjusting to body image changes. It's what we would expect to see. Maybe you feel self-conscious in social situations. Maybe sometimes you're having difficulties coping or difficult emotions arise. Um, but you're still able to go out and do things that you enjoy. It's not really holding you back from doing the things that you love to do, but you're experiencing some distress. Maybe distress when you look in the mirror or distress when you're going out in public for the first time, things like that. But all of that is to be expected. People who have more extreme body image concerns are really having trouble with day-to-day functioning. Maybe they're really avoidant and not going out in public much, or they're feeling very preoccupied by those body image changes. And then there's people who will tell me, I don't really have any body image concerns whatsoever. And it could be that you're genuinely not concerned about those changes. Or it could be that you really are reluctant to admit that you're having some concerns because you feel guilty, ashamed, or you feel like it's a vanity thing. And what I want to say is when I work with healthcare professionals, right, I spend a lot of time with them on this chart and I try to help them understand that no matter where anybody is on this continuum, there's a lot of things we can do to help provide hope, to help provide tips and strategies and treatment and interventions to address if body image concerns are really a significant part of kind of where you are right now with things. So, what are some of those tips? Let's get into that because that's probably the most important part of what I'm here to talk about today. Um, First, it's really about tips for talking to your healthcare team about body image. And I really encourage you to talk openly if you are having concerns about body image changes. Don't wait for them to bring it up because they might not. They may assume that you're doing fine and not having those concerns, and they may not even know how to ask. And part of this is maybe explaining the importance or the meaning of the body part that's being affected, is really to help explain that to them and discuss with them concerns not only about changes that have just happened, but also about any worries you have about future changes to the body. If you're having to think through other types of treatment options, if now you're going from surgery into radiation or chemotherapy, or you're kind of going into a new treatment modality, it's important to be able to talk through what are the expectations that they have on how your body will change and recover and heal, and being able to ask those questions and have that open conversation. It might be important for you to explain the way body images, if the body image concerns are affecting your life. If you're feeling very emotional or you're having some social challenges or issues or challenges at work, all of these things are important to be able to talk openly about this with your healthcare team. That, as I've said, this is an important and meaningful topic. It's not something that you should just brush to the side and not address. Ask for help, ask for referral for therapy if you need it, or whatever other resources they can provide. On a more personal level, I think that there's a lot of challenges that people have around talking to loved ones about their body image issues, okay? And that could be a spouse, that could be friends, family, acquaintances, coworkers, I mean, whoever it is. But I would encourage you not to have to suffer in silence or struggle alone with this. You likely have people in your life who can be a good listener and who can offer empathic responses to you. This is not about trying to get other people to give you suggestions on how to fix body image changes or how to, work through it or what to do. It's not about that. It's about having somebody be able to listen and just sit with you and explain to them this is not something that they can solve for you. This is something, though, that there could be people in your life that are wanting to support you, that are wanting to listen, that are wanting to be there for you. So I encourage you to think about that. One thing I do want to address is this idea of people making a lot of well-meaning comments about your appearance. I hear this a lot from people I work with, both family and friends, as well as healthcare professionals, sometimes really like to talk about how good you look when they see you. You look great. You look amazing. You look so good. And if you're not feeling that you look good or amazing or great, and you're struggling with body image, let's say it's appearance related and you're struggling with that, sometimes those comments can be really difficult to hear. And what I want to do is offer some ways for you to think about how you can respond to that. Okay. If you have people who are really doing a lot of cheerleading and reassurance to you, and that's not in a place where you are feeling comfortable, sometimes it's educating those people that those comments are difficult to hear, right? I'm not in a place right now where I'm feeling comfortable with my appearance. If it's somebody you're close enough with and you want to be vulnerable with. And sometimes it's helpful to tell people instead of telling me how good I look, it would make me feel better right now to just focus on it's nice to see you. I'm so happy to see you. I'm happy we can be together. I'm happy to spend time with you. Taking the focus off the appearance. And sometimes, if you're able to educate people that those appearance related comments are hard to hear and it's better to just focus on how glad we are to be together, that can be very empowering for you because it helps you have a little bit of control over that narrative and not just brace for the uncomfortable comments. Another thing you can do is obviously just redirect them and not get into the vulnerability of not wanting to hear about appearance and just change the topic. Um, Another thing, so I kind of have these four techniques, right? One is to educate people and to redirect them to not talk about appearance. Another is just to redirect them on another topic altogether. And another is to just accept the compliment and say thanks and move on and focus on what that could mean for you if you could just accept that compliment. Because oftentimes when people are providing that to you, they mean it. They are happy to see you, and there is something about seeing you that they think you look good, and they're relieved, let's say, at being able to be with you and be joyful about how wonderful they think you're doing and how good you look. And being able to accept that at face value sometimes can also be helpful if you can get to that point. And then the other thing I often ask people to do is to develop some sort of an internal mantra. If those types of comments are really bothersome to you, is there something you can tell yourself, right? I'm a work in progress. I'm getting there day by day. I'm doing better today than I was yesterday. Whatever it is that you can develop your own internal mantra, could be helpful in those moments. So that's a few tips. And then of course there's just again this idea of dealing with grief and loss and changes of body image. I want you to be able to kind of hold on to a little bit of recognizing the room that you might need to grieve some of the changes that have happened to your body, while at the same time holding on to hope for the future that you're going to find ways to cope. There are some aspects of this that are going to get better with healing, with time. But it's about kind of holding on to both of those because you do need to give yourself permission to grieve if you're having a difficult time. You need to be able to acknowledge the potentially the pain and the suffering that's associated with this. And also sometimes just taking this non-judgmental stance towards grief, and allowing your feelings and thoughts to be as they are is really, really important. Because when we start criticizing ourselves for having a difficult time or difficulty with body image changes, that does not help the situation. A big part of this is challenging yourself to respond with kindness and compassion for yourself, right? Being able to do that is really, really important. Um, and I put down here, look for patterns and signs that alert you to a grief encounter. A lot of times when you're struggling with body image changes, it's because something has triggered that. Whether it's looking in the mirror, somebody saying something to you, um, it being an anniversary around your cancer experience, going in for a scan, any of those things, it doesn't come out of nowhere. Oftentimes, when you are being triggered and you're having a grief response or a difficult emotion or difficult reaction, sometimes it's important to just be able to look at that more with curiosity of what just happened before, what's happening today that's setting the stage for this, and just developing a little bit of a level of noticing what's happening, trying not to be judgmental or critical of yourself for having those thoughts and feelings, and showing some compassion for yourself in those moments. Those are really the keys. Some of you may have been dealing with hair loss, or that's a really significant body image change that can affect people very significantly. If you are at a place where this is either happening to you right now or about to happen to you, I do have a resource here. This is a wonderful book called Wig Ed, and it talks all about what to look for when looking for a wig. So I encourage people to consider wigs and wig alternatives. There are opportunities for you to learn techniques for recreating eyebrows. There's a lot in this book about how to vet a wig store, some really specific techniques. Some of this, I kind of put a few tips up here, right, is enlisting someone to shop with you and not going that alone. And also making sure that you understand that there is something called a prescription for a cranial prosthesis that your oncologist can provide that can be submitted to the insurance company. And this is a website that has some more information. And there's a lot of really great tips in here. And if anybody has any questions about some of these and wants more information, I am available. My contact information will be here if you want to contact me after the talk today. Another thing that I work a lot with people on is tips for mirror viewing. And I try to do this before they have a surgery or something that they know is going to result in a significant change to a body part, a loss of a body part, or a change or scarring or in something like that. Ideally, you would get some of this information before that happens to prepare you for how to do this for the first time. But a lot of these tips can actually be really helpful if you've already had significant body changes and you're struggling with viewing yourself in the mirror, you're struggling with looking at the affected body part. So I want to just go through a few of these if we can on the call tonight. First is obviously being able to acknowledge the emotions that go with this, being able to label and name what those emotions are, if it's sadness or if it's disgust or if it's whatever those emotions are. There's a lot that can go in there, anger, those types of things. And sometimes it doesn't always have to necessarily be negative emotions, right? I think that there is a certain amount of gratitude and gratefulness and um, things that play out there. So it can be a lot of different things happening. But I do encourage people, if you are either already having trouble viewing body parts that have been affected by your cancer treatment, or you are about to go through that is the importance of being able to look at the body part. Do not delay that. Do not put that off. Do not avoid that. Do not continue to avoid that, whether that's looking in the mirror or looking at the actual body part. So, for people, for example, when they have surgery, I say as soon as you're able to remove the bandages, meaning you have been given medical clearance to do so, that is the sooner you do that, the better. Because what it allows you to do is it allows you to move in towards greater body image acceptance. That's an important first step. I also tell people if you're having difficulty looking at it, sometimes you can just take a picture and look at the picture, and that's a first starting point. Um, and you don't have to look at it all at once. You could look at small portions of it. Talk about that. Another thing I tell people is if you're having difficulty viewing yourself in the mirror or looking at the body part, is to dim the lights. Don't look at it with the lights on all the way up. Like dim the lights or turn the lights off and look in the dark and work your way up. We'll talk about using mirrors. Mirrors can be a very effective tool. Mirrors come in all different shapes and sizes. Sometimes I will give my patients a very small little compact makeup mirror to look at certain body parts if they and to not encourage them not to use a magnifying mirror to start or like a full body mirror, but work your way up with different size of mirrors. Using your sense of touch, that's another way you can connect with your body if it's safe to be able to touch the part that's been affected. If there's enough healing that's happened and things like that, there's no open wounds, obviously. We have to be past that phase, but that can be really important. And a lot of times I'll go through relaxation exercises with people before they start doing some of this work if they're really anxious about viewing themselves. And of course, it's the same mantra of really being compassionate to yourself. I want you to ask yourself if you were to describe parts of your body or ways that your body has changed, what you're saying to yourself in your own mind. Sometimes there's really harsh, negative, critical language that I hear from people. And I often ask them the very simple question of, would you ever say that out loud to a friend? What you say about your own body, would you ever say that to another person? And the answer is no, I would never say that to somebody else, right? These kind of internal thoughts you have. So you have to ask yourself why you would have different standards for yourself than you would have for someone else. And so these are all things. It's hard for me to go through this type of a talk in a short amount of time because I could probably spend a half an hour just on this. I will tell you that I do have a tip sheet for patients specifically on this topic of mirror viewing or coping with scars. And if somebody wants that information, I'm happy to send that out to the group. So it just gives a little bit more. I want to talk a little bit about functional changes because, again, this is not people who struggle with body image changes. It's not just about what you see when you look in the mirror, it's about other ways that your body changes. If you think about the pain or the tingling or the numbness, or if you're having other functional challenges with walking or eating or speaking, all of those things are body image changes. And it's really just important for you to be able to be patient with your body. I think some of these things I'm telling you, you already know, but I'm trying to remind you and bring this back to mind. With the functional changes, it's really important to focus and appreciate small improvements and to not continuously be comparing yourself to what it was like before treatment started or before you were diagnosed with cancer. That comparison is obviously not fair. So it's important to be able to focus on what is better today than it was yesterday, so on and so forth. And I'm sure that y'all talk a little bit about activity pacing and the importance of that. And again, a lot of when things aren't going well or you're struggling with something, it's really important to take a step back and try to look at the triggers and the patterns because it's not coming out of the blue. If there's one thing I could tell you now, when you're feeling emotional about it's already in the back of your mind that you might be struggling with something. But what brings it to the forefront of your mind is there is an event or something that has triggered that. And sometimes being able to recognize those patterns allows you to feel more comfortable and confident in managing because you know what's about to happen. It's not coming out of the blue. Um, so let's talk a little bit about social situations because I think this is something, right? We've talked a little bit about what it's like for you when you're viewing yourself or your own kind of internal struggle around how you see your own body and how you feel about your own body. It brings it into a whole different situation when we're now talking about going out in public and you're worried about how other people are viewing you and what other people are seeing and how you're behaving in that situation. So, some things I would like to really offer for you to think about today is really exploring and challenging your body image assumptions, what you think other people are thinking about you and how you look, whether that's going into a work situation, going into a situation with close friends, being with your spouse, or being with acquaintances. There's a lot of times where people are very hyper vigilant to what people are staring at or looking at or what they're thinking. And what I encourage you to understand is that you don't know what other people are. You don't have special mind reading powers. Nobody here is clear. Like we can't go into people's brains and understand exactly what they're thinking. There might be times where they are going to notice something that's changed about your body, but it might not be always. You might not always be right about that. And so it doesn't really help to get into those mind games of what you think other people are thinking. Okay, so that's kind of like recognize when you're doing mind reading and when you're doing fortune telling, and recognize you don't have those powers. And take it back to understanding that it's only normal for you to feel self-conscious about body changes. If you're going into a situation where something has changed and especially if it's visible to other people, it's normal to be self-conscious about that. I would love to encourage you to try to take the focus and the emphasis off what you think other people are noticing about you and put the emphasis on nonverbal communication strategies and what you do have control over. So part of this is recognizing that even if something is different about how you look, okay, even if it's hair loss, weight, scarring, whatever it is, people are more influenced by the way you behave over time than by the way you look. They get past seeing something that might be different. And they if you have an engaging personality, if you're funny, if you're using good eye contact, let's talk about those basic like body language strategies. You're smiling, you're nodding, you're engaged in the conversation. All of those things carry so much weight, and you have complete control over those things, okay? I encourage you, though, to be prepared for questions about your health or comments about your appearance. I've given you some strategies before of how to deal with that. But, and every time you go into a situation, even if it doesn't go well and you end up not feeling good about how you reacted or responded, that's a learning experience. You can use that the next time. You also need to be able to set boundaries and know your limits. You don't have to go to a party or a social gathering for the whole amount of time. You can show up a little bit late. You can leave early. You can have a signal with someone else if you're feeling uncomfortable and need to leave. There's lots of things you can do to manage those social situations. But biggest part of this is really trying to position your body in a way that you feel comfortable. Because I tell you, a lot of times, if you're trying to hide something about your appearance and you're trying to position your body so people can't see something about you, sometimes that's actually more obvious than just going in and trying to present with broad shoulders and standing up straight and nodding and smiling and those types of things. So, something to think about. This again is a whole nother long topic that we could spend a lot of time on. And so I just want to give you a few little tips that might be helpful to think about. Um, Starting the conversation with your partner, if you are having concerns about intimacy that are related to being self-conscious about body image, it's important to have that conversation. Anything that you're worried about, they may be worried about too. If there's something on your mind, it's probably on your partner's mind too. And a big part of this is reminding each other that you're in it together. A really common fear is that your partner's not going to find you attractive anymore, and they want to be able to reassure you. And being letting them do that is helpful and useful. And a big part of this is acknowledging what's changed and being able to voice your concerns and really do a lot of listening to one another. Big part of this is just listening to what the other person has to say and being very patient when it comes to intimacy. Big part of this also is trying to focus on maybe things that haven't changed. Also, remember what has not changed. And that doesn't necessarily have to only be about what hasn't changed in the body, but what hasn't changed about the care, concern, love, history that you have together. Um, Focusing on only the things that are different after cancer can lead to frustration. And as again, remember the important things that have stayed the same. Um, so here's just a few of my top body image lessons that I do like to make sure I state. Some of these things I'm reminding you of. I've already said this before, but some of this might be new information. People are more influenced by the way you behave rather than how you look. I've already said that. I say it again for emphasis. Your appearance is a much bigger issue for you than it is for other people. Um, I think that's an important thing to remember as you go into social situations. This one I haven't talked about a lot, but I will say it as strongly as I can. Never underestimate the importance of wearing comfortable clothing. That could be the texture of something, it could be the fit of something, it could be the fabric of something. If you're not wearing clothes that are comfortable and you're still trying to put, if your body's changed in a way and you're still wearing clothes that don't quite fit the body in the way it's changed now, really do what you can to find things that do make you feel good when you put them on your body, because that can make a really big difference into how you feel about your body. Um, I said this many times and I'll say it again. If you find that you are really not being compassionate to yourself when you're going through body image changes, it's important for you to work towards showing compassion for yourself and recognize when you're criticizing your body and trying to just understand, when is that happening? What are some things I can do to help myself soothe and comfort myself as I'm going through this difficult time? Learning how to accept a compliment about your body can be very empowering, even if it's just to say thank you and move on. But at the same time, what I want to actually challenge everybody today is to think about compliments you can give your body. You yourself have voice and agency over that. So this comes up to the next question. I've talked a little bit about, body image distress and concerns. I want to think about, what aspects of your body do you like? What aspects of your body are you satisfied with? We want to be able to hold together. This is kind of where this comes into this concept of body image acceptance. Body image acceptance doesn't mean loving everything about your body or accepting everything about your body in a way that makes you feel good about all aspects of your body. It's really about coming to term with the fact that there are aspects of your body you don't like and there's aspects that you like, and we want to hold both of those together. Okay. And a big goal here is having unconditional care and respect for your body, despite the changes that have occurred as a result of illness and its treatment, and working towards recognizing and celebrating aspects of your body that you enjoy. Okay, now that could be physical features of your body. Maybe there's, if not a part of your body that's affected by cancer, but one that hasn't been, that you can still appreciate and enjoy. But it could also be about things that your body does for you, being able to stretch, being able to hug someone, being able to, your eyes being able to take in beauty, all of these things. Think about all the different senses of your body, being able, if you have food that you can enjoy, if that hasn't been affected, that might be something you can appreciate. But it's finding something that you can hold on to and really focus on. These are the parts of my body that I like and that give me joy and happiness or meaning. And so we have to hold those things together. So, this is where I talk with people a little bit about ways to promote body esteem. And that is a term that usually refers to comfort with your body or comfort and confidence in your body. And so, I have these different buckets. And I would kind of ask you to think about, if there's one of these buckets you may be struggling with or not. Um, what are some things you can do? So I encourage people to come up with appearance enhancing activities that make them feel good about their bodies. And these are some examples, right? It doesn't have to be spending money, it doesn't have to be going out and buying something new, but getting dressed up, wearing your favorite clothes, um, putting on makeup, wearing a cheerful color. All of these things are things that I encourage people, if they're really struggling with their feeling not good about their appearance, is to plan some of these activities in a very um, intentional way. So, having a goal next week of doing 3 things that help enhance your appearance and being mindful while you're doing them about how it feels on your body, and sometimes journaling that. That's something I go through with people. The sensory pleasing experiences are maybe not things you've thought about as ways to connect with your body, but these are things that don't actually necessarily require physical activity. Okay, when you're going through treatment and you're not feeling well, these are some things that may be more passive experiences that allow you to connect with your body. Just being outdoors or wearing something soft, looking at a sunrise or a sunset, hugging someone, listening to music. You think about different senses that you have. This is a bucket that really works well for people if they're going through active treatment, especially, and they're having trouble more doing physical activities. But on the health and fitness side, again, it doesn't have to be rigorous activity, right? Stretching, playing with your kids or your grandkids, that is a physical activity. Walking, dancing, meditation, swimming, gardening, there's lots of ways you can do that. So I encourage you to come up with some of your own lists for that. So I'm winding down. I want to give you my contact information. This is how you can find me. My website does have a lot of resources for survivors as well as for healthcare professionals. You can contact me with any questions, follow me on Instagram, Facebook, those types of things. I do try to put up more body image tips and things like that. And that's it for me.